foods may help some people manage their symptoms of anxiety. Fatty fish, eggs, turmeric, and pumpkin seeds are among the options. Anxiety and stress is a common condition that affects millions of people worldwide. Symptoms vary, and some people only experience them now and then. However, a person who has had symptoms for 6 months or longer may have generalized anxiety disorder, GAD. Generalized anxiety disorder, GAD, has psychological and physical symptoms such as afraid, tension, excessive worrying about daily events and problems, irritability, difficulty concentrating, issues related to personal, social, and work relationships, heart palpitations and elevated heart rate, muscle strain, sadness. Doctors often treat generalized anxiety disorder with a combination of treatments, including talk therapy, such as cognitive behavioral therapy, CBT, and medication. Sometimes, these conventional treatments don't work in the long term. However, some research suggests that proper nutrition may help improve symptoms. 8 foods that help reduce anxiety and stress. Transitioning to a healthy, nutrient-dense diet may help relieve anxiety symptoms for some people. General dietary intake, along with therapy and medication, can be a useful tool for managing anxiety. Eating the following foods may help reduce anxiety in some people. 1. Fatty fish. Fatty fish, such as salmon, mackerel, sardines, trout, and herring, are high in omega-3s. Omega-3s are a type of fatty acid that has a strong connection to cognitive function and mental health. Omega-3. Omega-3-rich foods contain either alpha-linolenic acid, ALA, or 2 essential fatty acids. A 2018 review found that a reduction in anxiety symptoms was associated with omega-3 polyunsaturated fatty acid treatment. The effects were strongest in participants with clinical symptoms of anxiety. Current recommendations suggest eating at least 2 servings of fatty fish per week. A study of men found that eating salmon 3 times a week reduced subjective anxiety. Vitamin D. Salmon and sardines are among the few foods that contain vitamin D. Researchers are increasingly linking vitamin D deficiency to mood disorders such as anxiety. Research has linked low blood levels of vitamin D to features of depression and anxiety, although more studies are needed. People with a vitamin D deficiency should consider taking high doses of supplements rather than eating fatty fish alone. Other studies of pregnant women and the elderly have also highlighted how vitamin D can improve mood. 2. Eggs. Reliable egg yolks, especially from pasture-raised chickens, are another good source of vitamin D. Eggs are also an excellent source of protein. It is a complete protein, meaning it contains all the essential amino acids that the body needs for growth and development. Eggs also contain tryptophan, an amino acid that helps form serotonin. Serotonin is a chemical neurotransmitter found in the brain, intestines, and blood platelets that helps regulate mood, sleep, memory, and behavior. Serotonin is believed to improve brain function and reduce anxiety. However, it cannot cross the blood-brain barrier, which means that food and treats that contain serotonin do not supply serotonin directly but can trigger serotonin-enhancing chemical reactions in the brain. Some studies suggest that diet and gut microbes can play a role in preventing and treating symptoms associated with anxiety. More research is needed to confirm if this is possible. 3. Pumpkin seeds. Pumpkin seeds are an excellent source of potassium, which helps regulate electrolyte balance and manage blood pressure. An older 2008 study found that low levels of potassium and magnesium were associated with higher levels of cortisol, a stress hormone released by the adrenal glands. Eating potassium-rich foods, such as pumpkin seeds and bananas, may help reduce symptoms of stress and anxiety. Pumpkin seeds are also a good source of the mineral zinc. One study of 100 female high school students found that blood levels of zinc were inversely related to mood disorders, including depression and anxiety. These results indicate that increasing blood levels of zinc can improve mood disorders in some people. Zinc is essential for brain and nerve development. The largest zinc storage sites in the body are located in areas of the brain associated with emotions. 4. Dark chocolate. Experts have long suspected that dark chocolate may help reduce stress and anxiety. Some research has found that dark chocolate or cocoa may improve mood via the gut-brain axis. However, many of the current studies on this topic are observational studies, so it is important to interpret the results with caution. Although it is still not clear how dark chocolate can improve mood or stress, dark chocolate is a rich source of polyphenols, especially flavonoids. One study suggests that flavonoids may reduce neuroinflammation and cell death in the brain as well as improve blood flow. Chocolate is high in tryptophan, which the body uses to convert into mood-enhancing neurotransmitters like serotonin in the brain. Dark chocolate is also a good source of magnesium. Eating a diet that contains enough magnesium or taking supplements may reduce symptoms of stress and anxiety. People with a magnesium deficiency should consider taking high doses of supplements rather than eating dietary sources alone. When choosing dark chocolate, aim for 70% cocoa or more. Dark chocolate still contains added sugars and fats, so a small serving of 1 to 3 grams g is adequate. 5. Turmeric. Turmeric is a spice commonly used in Indian and Southeast Asian cooking. The active ingredient in turmeric, called curcumin, may help reduce anxiety by reducing inflammation and oxidative stress that is often increased in people with mood disorders such as anxiety and depression. A 2015 study found that 1 gram of curcumin per day reduced anxiety in adults with obesity. People should discuss supplementation with their physician if they are interested in higher-dose curcumin products. Another study found that increasing curcumin in the diet also increased DHA and reduced anxiety. Turmeric is easy to add to meals. It has little flavor, so it's good in smoothies, curries, and casserole dishes. 6. Yogurt. Yogurt contains healthy Lactobacillus and Bifidobacteria. Emerging evidence from reliable sources indicates that these bacteria and fermented products have positive effects on brain health. According to a 2017 clinical review, yogurt and other dairy products may also produce an anti-inflammatory effect in the body. Some research suggests that chronic inflammation may be partly responsible for anxiety, stress, and depression. A 2015 study found that fermented foods reduce social anxiety in some young adults, while multiple studies found that eating healthy bacteria can increase happiness in some people. Including yogurt and other fermented foods in the diet can benefit normal gut bacteria and may reduce anxiety and stress. Fermented foods include cheese, sauerkraut, kimchi, and fermented soy products. 7. Green tea. Green tea contains an amino acid called theanine source, which is under increasing scrutiny for its potential effects on mood disorders. Theanine has anti-anxiety and calming effects and may increase serotonin and dopamine production. Green tea is easy to add to your daily diet. It is a suitable alternative to soft drinks, coffee, and alcoholic beverages. 8. Brazil nuts. Brazil nuts are rich in selenium. This source of selenium may improve mood by reducing inflammation, which is often at elevated levels when someone suffers from a mood disorder such as anxiety. Selenium is also an antioxidant, which helps prevent cell damage. Other nuts, animal products, and vegetables, such as mushrooms and soybeans, are excellent sources of selenium, too. It is important not to take too much selenium, as it can cause side effects. The recommended upper limit for selenium for adults is 400 micrograms per day. Be careful not to take high doses of supplements, or eat more than 3 or 4 Brazil nuts per day. Brazil nuts and other nuts are also good sources of vitamin E, an antioxidant. Antioxidants can be helpful in treating anxiety, and some research has shown that low levels of vitamin E may lead to anxiety in children. When to see a doctor for anxiety? When a person suffers from anxiety and stress, it is always a good idea for them to seek out a professional, such as a psychologist. Sometimes, a doctor or mental health professional may recommend talking therapy such as CBT to manage anxiety and stress. Doctors or psychiatrists may prescribe medications. People should follow their doctor's instructions when using these medications, as they can have severe and potentially life-threatening adverse effects. If you like the content, do not forget to subscribe to the channel, like the video, and write in the comments about any topic for which a video was created. And share this video with whoever deserves to benefit from it. Wait for the new videos.